Alright, so today I'm going to do a nasotracheal suctioning. So as always, I always want to check the charts and make sure I don't notice anything that I need to do while I'm with the patient. So before I go in the patient's room, I always want to be prepared and always have the proper necessities that I may need. If I need to bring a gown, like a gown with me, cap, the nasotracheal suctioning kit, everything that I may need. So once I get in the room, I always need to knock before I enter, and then I always want to introduce myself, then check their ID band. So when I'm ready, I need to wash my hands, then I need to properly dry them, then apply the appropriate gloving before I begin to help with the patient. So when I'm ready, I need to go ahead and assess the patient. I need to check their vital signs before the procedure. And then I need to also listen to the lungs to see if I hear any abnormalities that I may hear and which lungs need to be cleaned more, which ones are having more, which lung is worse. So when I'm ready, I'm done with that. I need to get my suctioning machine ready. And so you never want it to go over 150. So the way you can tell that, after you check the tube and make sure there's no kinks, you can occlude this to see where it's at. And right now it's at 140, so that's pretty good. It's not over 150. So I will just set that there to make sure it contains its sterility there. And then for this one, I'm going to do with the nasal trumpet. So as always, with any nasal trumpet, you want to measure with the patients. That way you don't have too big or too small. So what you do is take the nasal trumpet. You can measure it by the earlobe here to the nose and see if it's long enough to go into the nose. So, and you can also check the bevel here to make sure it's not too big for the nose. And then you would always like to check the inside the nares to make sure there's no obstructions in there, nothing, no deviation in there. So with this, you always want to lubricate the end of the nasal trumpet, that way it goes in smoothly, and you never want to just shove this in there, so you want to go in gently. So this always needs to go towards the septum, so you want to go on this side here. Like that. So once that's ready, and then I want to oxygenate the patient, I want to hyperinflate their lungs. So with the nasal trumpet being in place, that can also help with getting that oxygen to the patient. So as always, you always make sure the machine is turned on with the patient. And so like this, once like the bag is inflated, and then that's a good place to be. All right, so once that's ready, I'm going to remove my gloving, and then I'm going to get my kit ready. So I'm going to wash my hands, and after I had all my stuff out, I make sure my sterile gloves are ready, not to touch them or anything. And then I would always make sure my lubricant's ready. You can put your lubricant on the cap of the lid of the nasotracheal suctioning kit, or you can get some clean gauze and put it on there. So when I'm ready, before I touch the catheter or anything like that, I always want to place on my appropriate PPE. So I want to place on my sterile gloves, make sure I have a gown on, cap on, a face shield, so that way nothing splashes on me that I could get, that could harm me or get on to me. So once I have these on, I always want to make sure I have my sterile water in here with the catheter to make sure it's sterile. And then with my same thing with my non-dominant hand, I'd grab the tubing, and then I would grab the catheter, and I'd place it into here with my dominant hand. And as soon as you know it's connected, you can hear a hissing sound. And so always, before you begin to put this in the patient's nose, you always want to suction up some sterile water to make sure it's suctioning up properly, and that can also help lubricate the inside. So then you want to take the end and you want to put it in your lubricant to make it go down smoother into the patient's nose. So when I'm ready, I will remove the oxygen from the patient, and then I will go in very gently into the patient's nose. I want to go into the trumpet slowly. And if I feel like a blockage, I can have them cough for me. And as always, you never want to be in the patient's suctioning anything more than 15 seconds. So when I'm done, I can slowly remove this. And you want to go as close as you can to the end so you don't splash anything if there's anything stuck to the end. And if you ever want to resection, always make sure you oxygenate the patient again. That way their lungs are hyperinflated and you don't cause any atelectasis, anything like that for the patient. So you always want to re-sterilize. So you want to put it in the sterile water again. Make sure it's all clean again, and then you can do it again. But the only thing is with this, you don't want to do it more than 3 times. So when I am done, I can wrap this around my sterile glove very carefully, not to get anything anywhere else, and remove it. I can set this over here, and you want to remove the catheter with your sterile gloving, and then you dispose of it in the proper waste bin. So after I'm always done, I always want to wash my hands, so I'd wash my hands again, dry them, and then I would apply the appropriate gloving. And I always want to make sure I remove like any of my gown that I may have on, my cap, face shield when I'm done. So then I'm always, when you do a procedure, you always want to make sure you check their vital signs again and always get their lung sounds. And if I feel that the patient is okay without the oxygen, and when their lungs are back to where they need to be, I can remove the oxygen from the patient, shut it off, and then sometimes if you may have to come back, you can leave the nasal trumpet in, but you don't want to leave it in for a long amount of time. So when I am all done, I always want to chart what I have done for the patient and all of the oxygen that I had placed him on. I need to make sure I put down the liter flow that I put him on, and then let the nurses know that I did a suctioning.